A very good afternoon to everyone. This is Fahad Shahid here with you. We're live from Prime Health page and our YouTube channel, Prime. A very important day today, World Hypertension Day. And when you talk about hypertension, there is a lot to discuss, there's a lot to give information, and that's what we are here for. We've got Dr. Murali Krishna, who's a specialist interventional cardiologist at Prime Hospital with an extensive experience of 28 years in the field, and out of which 14 years he's been practicing in UAE. Thank you, doctor, for joining us today here.
Most welcome. Thank you.
When we talk about hypertension, obviously we all know that what is hypertension. Just giving a reminder that high blood pressure is also called hypertension. It's a blood pressure that is higher than normal. Your blood pressure changes throughout the day based on your activities. Having blood pressure measures consistently above normal may result in diagnosis of high blood pressure, or you call it hypertension day. That's the day that we have dedicated it today. We are going to talk about hypertension in our topic today, because measure your blood pressure accurately, control it, and live longer. This is the motto of the topic for today. Dr. Murali will be initially talking about hypertension, and once he's done with the talk, we will be taking live questions from your comment section. So do send us your questions if you have anything related to hypertension, and Dr. Murali is here to answer. We already have some questions that were sent to us through registration. We'll be asking those questions to Dr. Murali also. Doctor, World Hypertension Day, a very important topic, and a lot of people are actually into this disease, I believe. So I believe today's talk will be very, very important from your end, and I would really not delay. You can proceed. Thank you.
Thank you, Fahad. Yeah, it is actually my honor and pleasure to be part of the World Hypertension Day celebrations here in Prime Healthcare Group. Actually, it's more of an awareness day because, essential hypertension is a very common disease. And unfortunately, the importance of blood pressure control or normal blood pressure is not very much appreciated because hypertension, as rightly being called a silent killer, does not cause much of issues for a person who has this. Just because you have a blood pressure more than the acceptable range, it does not mean you may have any physical issues because of that. It's just a very silent disease, and that is the problem with essential hypertension. We may not be aware of that it is causing a lot of damage to our organs without we knowing about it, and that is the problem. If you see the worldwide cause for mortality, the number one reason for a person to die due to a heart attack or a stroke or a kidney failure, the number one reason is the risk factor of blood pressure, high blood pressure or hypertension. So, and this is the most common condition seen in primary care anywhere in the world. So any general practitioner, is the commonest condition which he can pick up is essential hypertension. Even though we do find a majority of people with high blood pressures, many of them may not just follow up on that, because just one reading cannot help us in diagnosing high blood pressure. It is a serial follow-up. Also, presently, the use of home BP monitoring that actually helps us in finding out this hidden iceberg of hypertension. The main reason why hypertension is the number one risk factor is that persistently high blood pressure in your arteries, in your blood vessels, can damage your heart, your kidney, your brain, and your eyes. So the vital organs are all affected by the high blood pressure over time. So controlling blood pressure is essentially the most important intervention that we can do to prevent us from getting into a heart failure or a heart attack or a bleed in the brain or a blood flow problem in the brain, or for that matter, into long-term dialysis. So how do we diagnose high blood pressure? It is basically a diagnosis after you visit a doctor. The ideal blood pressure for all of us, irrespective of age, is now put as 120 by 80 millimeters mercury or less by all different guidelines around the world. By guidelines, what we mean is that there are certain protocols for diagnosing, treating blood pressure, which have been made after going through several important studies for drugs to treat hypertension. So from all these studies, which may include a drug or which may include diet and exercise, or which may include a placebo. By placebo, what I mean is that it is like a drug, but it has no effect. So that is how we find the importance of control of blood pressure. And all these studies have proven beyond doubt that the optimal blood pressure for everyone, irrespective of age, is 120/80 plus. If you have a blood pressure above 140, the upper one, the systolic one, or more than 90, the diastolic or the lower one, then you definitely are into stage 1 hypertension. In between, there are some classifications which call it as high, normal, or elevated BP. But basically, the target is, in the long run, is to get into the optimal blood pressure range. Once you are diagnosed as hypertensive and you are asked to do the diet, exercise, and of course the medications for some people, you are supposed to keep your blood pressure below 130/80. That is your long-term target. If you are not able to achieve this target, then again you are at risk for getting any of these problems. So it's very important that once we diagnose blood pressure, we are regularly, we'll be following up with the doctor, also doing regular home BP monitoring and making sure that whatever intervention we do, let it be weight loss, diet or exercise, or maybe medication, we are supposed to sustain that effect by properly, periodically checking the blood pressure value to make sure that it is under control. Now, this phenomenon of blood pressure, 90 to 95% of the time, is essential or idiopathic or primary. What we mean by that is that it is the genetic factors which are modified by the environment, which unmasks the blood pressure inside you. So if you have, it's basically a genetic disease, but definitely the environmental influence unmasks the age at which we have a high, we get a high blood pressure. The environmental factors, definitely the body weight is very, very important. Any body BMI above 25 is definitely a risk factor for you to get into the hypertensive blood pressure range. So keeping your ideal body weight is very essential. Or if you are obese and if you have hypertension, coming back to your ideal body weight, BMI ideally in Indians or in South Asians, it should be less than 23.5, and definitely it should be less than 24.5 for Caucasians. So if we achieve our ideal body weight, that's one very important milestone which can help us to control our blood pressure. The other factors are, of course, the stress. The stress, of course, these are things which, many of these things are not in our control. But then doing regular physical activity, keeping your body weight under the BMI, what is told, and also doing regular exercise, eating healthy. By eating healthy, I mean the amount of salt in the food should be reduced. Also, we should include a lot of fruits and vegetables in our diet, and all kinds of refined food or processed food should be out of the diet. Any product, a processed food which has a longer shelf life, be it the usual bread which we buy from the grocery, even that if the shelf life is longer, that means the salt content in that product is little more than normal. So any product with a high salt content should be avoided. Also, with a lot of processing and uh, refinement, which includes, the wheat converted into maida, all that is not good for in the long run. With this brief introduction, um, I will also emphasize that, in the long run, it is very important to continue your home monitoring or outside the hospital monitoring to make sure that the blood pressure is under control. There are people who have had a high blood pressure, who have done their part and reduced the blood pressure, but then they don't do a regular follow-up to make sure that the blood pressure is under control. Many times they don't do that, and blood pressure has definitely a genetic basis also, and it can definitely come back. So it's very important that we monitor it and take the and do the needful for the same. 5 to 10% of cases of blood pressure can be called because of secondary causes, which maybe because of use of certain medications like long-term steroids, uh, which may be essential for some people to maintain their health. So in such cases, or if people who have some kind of a kidney disease, like or a kidney tumor, or some other adrenal diseases, some hormonal imbalances, all these people can also have high blood pressure, which can be treated partly by controlling the risk factor and partly by medications as well. With this brief introduction, and with one more time just reminding you that this is the most important diagnosis in primary care and the most common cause for mortality worldwide. It is the level of the deaths caused by hypertension related problems are much more than smoking, and the third one is the cholesterol. So hypertension is way ahead of both smoking and cholesterol in creating issues for us. Yes, Fahad.
Thank you so very much, doctor. That was a very brief and information, and it was. I'm sure it was helpful to everyone out there. Now, doctor, because we have a very vast topic to discuss, but we are going to be very specific on some questions so that you can just answer them in a little detail only. I've got a question here that came to me. I have BP, sugar, cholesterol for the past several years. I'm intake medicines as of now. If there is any advice, please.
I mean, it's a very general question. Yes, if you have multiple risk factors, the risk for us getting into uh, a problem in the form of a heart attack or a stroke or a kidney disease is higher. So it's very important that we stick to targets. By what I mean is that if you have blood pressure, see to it that you keep the blood pressure always under control. At least it should be the upper systolic reading should be around 130 millimeters mercury or lower, and the diastolic reading should be tried to be kept below the target of 80 millimeters mercury. That's number one. We achieve some benefit with that. The second risk factor, if you have diabetes, yes, that also needs stringent control. And of course, if it's a long-standing diabetes, in addition to diet and exercise, we may need medications as well. And there also now we have specific targets like the 3 months average sugar reading, which is ideally now need to be below 7 or definitely around 6.5. And of course, the blood sugar control. The cholesterol also has very specific targets now. If we have long-standing hypertension and diabetes, like more than 10 years of diabetes, then we are supposed to keep our LDL cholesterol, which is the bad cholesterol, to less than 70 milligram percentage. So we have targets which I'm sure your physician will be adhering to or trying or encouraging you to adhere to, which is very important. And of course, the role of physical activity and diet, I cannot overemphasize here. I've already told about the BMI, how much the ideal weight should be. And definitely eating healthy and and doing regular exercise and burning calories definitely helps for any risk factor. for that matter.
Great. Thank you very much, doctor. I believe this is a very important question that I'm going to ask you, doctor. And I would like to add another question to it also. Is there a specific time of the day that I should take the medication? Uh, a lot of people, doctor, who are actually taking hypertensive medications, I've seen some of them are exactly taking just after the last bite they take of their breakfast, or you talk about dinner. What would be the right time? If you can just mention that. And does anxiety or overthinking create hypertension, doctor?
Regarding the first part of the question, which is the time of, it is always better to take the blood pressure or any other tablet at one particular time. If you are comfortable, if you are sure that every day, irrespective of it being a holiday or a weekday, if you can ideally take the blood pressure tablet at one particular time every day, it will be good. Morning is definitely preferable for most of the medications, and especially so for hypertensive medications, especially a class of drugs called as diuretics, where little bit of urinary frequency increase can happen. That can actually cause a little bit of increased frequency of urination in the night. So those drugs, or the drug which includes that diuretic, definitely should be taken in the morning. Even all the other drugs, if preferable, one particular time, but it should be always adhered to. It's not that one day you take in the morning, another day you take in the afternoon, and the third day you take in the evening, because that's not ideally the correct way of doing it, because all these medicines have a half-life, and for all blood pressure medicines, the half-life usually is within 24 hours. So it's very important that we keep the time every day. Regarding the second part,
Doctor, just one I added that talking about the food, like it should be after, exactly after food, or there should be a gap for taking the medication. Some people say that it's not effective just after the food if you take it.
Yeah, but ideally, if it's before food, it's better.
It's better before.
It's better,
Okay.
so that the absorption is definitely taken care of.
Okay.
Yeah.
Second part.
Yeah. The second part of the question was
anxiety or overthinking.
Yes, I already mentioned that it is the environmental factors over the genetic factors which unmasks blood pressure. And the environmental factor, one of the most common environmental factor, is the stress for all of us. That definitely matters. Reducing the stress by yoga or even by exercise, I mean some other way to make your mind more calm, that definitely helps.
Thank you, doctor. Doctor, how to reduce high blood pressure with regards to diet? What kind of diet we should have so that we can, reduce
see, there is a specific diet called as DAS diet, dietary interventions to stop hypertension diet, in which they have included a little bit of less salt than the usual amount of salt, and also almost 5 servings, which is around almost 100 grams of vegetables and fruits have been included, and they have taken away all the processed and the refined food. That kind of diet always helps. Reducing the amount of salt always helps. Whenever you buy a product over the counter or over the shelf, it is always better to check the amount of salt in it, the percentage of daily intake, how much percentage this particular product contains. That actually gives us a very good idea of the amount of salt in that product. Unfortunately, many of our shelved products have a very high salt content, because in the end, to increase shelf life, it's very common that the salt is the one which actually increases the shelf life of many products. So we have to have a balance between shelf life versus processing versus refinement and fresh food. And that's why the importance of fresh fruits and vegetables. But if you take fresh fruits and vegetables salted, then again there is no use. So the amount of salt, the table salt which you use in your food, is also equally important. So the amount of salt in general should be much less than what it should be.
Thank you, doctor. Doctor, taking hypertensive medications and controlling it down, of course, with the lifestyle change and diet, as you mentioned earlier, is it possible to leave the medication later on if we are under control, or it is for lifetime?
That depends on the stage of hypertension with which we have which unmasks itself once you reduce the tablet or stop the tablet. So if you are a hypertensive patient and say your body mass index was like 35, which is like you say your height is 175 and your weight was like 100 plus, you have done your part, you have done your exercise, and you have reduced it from say 105, you have reduced it to 75, which is a great achievement. So once you achieve your BMI, definitely you may even stop the tablet, because many times the blood pressure comes down. It is postulated that for every 10 kg weight loss, your systolic, the upper blood pressure, comes down by 10 millimeters mercury. So definitely weight loss helps. But as I always mention, blood pressure has a genetic component. So it is very, very important that we keep monitoring our blood pressure at regular intervals, ideally with a home BP monitor, and say once in 3 months or something with the doctor. You go to a clinic and check your BP there as well. You should make sure that the blood pressure is within the prescribed limit of ideal limit of 120/80, or at least below 135 upper one and the 85 lower one. If we can have that kind of value even in the home BP monitor, yes, then continuation of diet and exercise uh, with maintenance of the body weight, it can definitely help you to continue controlling the BP without medicines. But over the years, we have seen that as there is this genetic component, slowly the blood pressure creeps up. So it's very important that regular follow-ups are done, and if need be, like if there are people who have stopped medicines for 2 years or 3 years, but then slowly, over the years, it comes back again, and then we may have to start with a small tablet, but much less than the original dose. And many of them, in spite of reducing 30 or 40 kgs, may still have a high blood pressure, and that is those people who have a predominant genetic component. So such people may be able to reduce their medications from 2 to 3 to 1, but they may have to still continue that one single tablet to achieve their ideal target BP.
Got it, doctor. Doctor, another important question, doctor. Uh, the question is, how are few patients on higher risk uh, who have got this disease inherited, and how do you differentiate between two people, like the one with the inherited one and the one with who are actually getting the disease now? Are the one with the inherited on higher risk?
See, by genetic disease, the majority of hypertensives are basically essential hypertension, or 90 to 95%. There is no other cause for it. It just comes as a de novo disease. It doesn't mean it's inherited. It can be from your there need not be a predecessor with hypertension. Even without that, you yourself can be a hypertensive because of your genetic makeup. So and I've already mentioned that 90 to 95% of blood pressure is basically essential or without any other cause. So it's basically a genetic reason.
Thank you, doctor. Doctor, is black coffee better over milk coffee, or does it have impact on the heart rate?
Any coffee will have an impact on the heart rate because it's a stimulant. It has a lot of caffeine and it has other stimulants as well. So definitely your heart rate goes up, and there are people who have certain kinds of extra beats or tachycardias, wherein the heart beats faster than the usual. With coffee, they do have that. Milk coffee, yes, it can reduce the gastric side effects of coffee by making it little more less uh, irritant to the stomach. But otherwise, the amount of coffee remains the same even in milk coffee. So I feel there is not much of a difference.
So once a coffee in a day, doctor, is it fine, or
it's fine? It's fine. You see, if you are used to a coffee drink, if you are a coffee drinker, and if you are used to coffee drinking, reducing the amount of coffee will definitely help. But 1 or 2 cups should be fine.
Great, thank you, doctor. Another question, doctor. Will a stent inserted in the artery stay for a long time or till the lifetime if there is no block within the stent? how will you check the stunt intact or not without doing an angiogram?
Okay. This is not directly related to hypertension.
Exactly.
Yeah, but since I'm an interventional cardiologist, I can answer this question. See, stents are ideally put so that they are lifelong. But how do you maintain a stent? For this, the same answer comes for that as well. We need to control our risk factors. We need to keep targets for our sugar, pressure, cholesterol. We need to maintain our body weight. We need to do regular diet and exercise. We may have to continue a little bit of a high dose of a cholesterol tablet and also aspirin to maintain the stent. But of course, there is a 5 to 10% risk that the blood pressure can that the stent can get occluded over the years, and this is more so if you are a diabetic and less so if you are adherent to your medications and keeping a good exercise and diet regime. And of course, smoking also is bad for the stent in the long term. So if you can stop the smoking, that also helps in maintaining the stent. Now, how to know whether the stent is patent? It's always better to regularly have a once a year annual checkup with a cardiologist to make sure that the stent is functioning well. The basic test which we all would do is a stress test. You can do a little bit of a higher variant of stress test like a myocardial perfusion imaging or a stress echocardiography to know little more, to have little more sensitivity to assess the stent. And if those tests remain normal in the long run, it always indirectly means that 80 to 90% of the time the stents are all doing fine.
Thank you, doctor. Doctor, for the people who are actually chain smokers or smokers, I really want you to just answer this. Is hypertension directly proportional to smoking? And if so, how much effective it is?
Hypertension is not directly related to smoking, but definitely if you check your blood pressure within 1 hour of a puff, yes, you will find your blood pressure much higher than normal because the nicotine in the blood will cause vasoconstriction or constriction of the blood vessels, and this will definitely increase your blood pressure for some time. Smoking also has other deleterious effect in the form of um, secreting bad hormones into the arteries, which actually promote the constriction of the arteries and indirectly increase the blood pressure. And if you have high blood pressure, then and if you smoke as well, it's like you are having two risk factors because smoking in itself is a risk factor for heart disease, stroke, kidney disease. So if you already are a hypertensive and not getting a good control, and if you smoke also, then it's like a double effect.
Doctor, how can we monitor a heartbeat without any test? Because I'm a diabetic patient also. This is a question that has come up.
See, monitoring heart rate, nowadays we have enough and more Fitbit devices, these fitness trackers, and also smart watches, which actually give a reasonably accurate value of heart rate, which is one way of monitoring the heart rate. But just to monitor heart rate for every person, I don't think it's necessary. It's only for people who have a certain kind of abnormal heart rhythms called as arrhythmias that these things help. One particular condition which is very common in people with blood pressure or with other condition is a kind of heartbeat called atrial fibrillation, where the upper chamber of the heart beats in a very irregular fashion. The new Apple Watch and even the other trackers, many of them do identify this abnormal rhythm and indicate warn the patient that yes, such kind of a rhythm is happening. Because many times the patient may not be aware of this abnormal rhythm, and if this abnormal rhythm can cause stroke by forming a small clot in the heart. So to monitor for such people, definitely it helps.
Thank you, doctor. Another question, doctor, I have here is, what are my options if my blood pressure is not managed by my current medications?
The most common reason why there is an uncontrolled blood pressure is basically a lack of compliance or lack of um, uh, proper medication intake. Like I told, maybe you should take it before food. You should take it at the same time every day, and you should store the tablets as written in the box in the correct temperature. So all this actually helps in the long run uh, to increase or to maintain the efficacy of a blood pressure pill. But if it is still not controlled, that means that blood pressure is not caused by one kind of a problem in biochemical problem or a genetic issue. There are multifactorial uh, pathways which can actually increase your blood pressure. Some of them involves the bad hormones in the body. Some of them involves the arterial constriction and relaxation, that is the artery being stiff or relaxed. Also, some hormones from the kidney and from the arteries also play a part. So there are several ways to control the blood pressure, and the present medications what we use are from different kinds of hormonal inhibitors or vasodilators, so and diuretics. So there are several pathways by which we can control the BP. So there are many people for whom the reason for blood pressure is multifactorial. In such people, blocking one single entity to control the BP may not be the answer. So they may have to have multiple pills, and we do have multiple ingredients in one pill now in suboptimal doses. So we don't have to go to the highest dose of that pill. We go to a much lower dose of one pill and combine it with the lower dose of another kind of pill, which actually has a synergistic effect, which will help to control the BP in a better fashion. So if your blood pressure is not controlled, then yes, ideally we have to control it with adding certain medications which only your physician can assess and tell you.
Thank you. As we're moving towards the end of the session, Doctor, I've got one question if you can answer before we close the session. What are the signs of worsening heart failure?
Okay.
Apart from that, one second, Doctor. I've got another question here. This question was already answered. Sorry. Why is there more incidence of heart attacks in males than in females? Sorry, that was the question.
The females during their reproductive age, which is when they have this menstruation active, they are well protected by their female hormones, the estrogens and the progesterones. So they are protected from any form of cardiovascular problems during this age. However, as the age goes beyond 55 to 60, they also can get all these risk factors. The second important reason is the level of activity and stress. Actually, housewives work much more than many of the sedentary office job workers, and their calorie burning will be much more than a person who sits in the doing a blue collar job. So there are several factors, but mainly it is the hormonal which protects them in the reproductive age.
Doctor, just one last question I have here. What are the activities that can cause me to have angina, and how should I treat my chest pain or angina when it happens?
See, angina is mainly caused by a block in the artery of the heart. And one of the reasons why angina can happen is hypertension. Of course, there are the other risk factors like diabetes, smoking, cholesterol also can cause this. Angina is a symptom which the patient feels. Many times, at least in 30%, we may not find any blocks, but still they may have continue to have angina. Either it's not from the heart, or it may be from the small vessels called as micro vessels, which can be treated only by medical treatment. Angina, if a person has angina and it is disturbing his normal routine life, then yes, we need to do further investigations, including a stress test to find out if there is any block, and then go and proceed accordingly.
Thank you, Doctor. Doctor, thank you so much for the all information that you have given. I would really request you to, give a take-home message from here so that everybody would understand, and the people who are going to watch it later, they would really understand the whole session. So, what would the take-home message on this very important World Hypertension Day?
Yeah, briefly talking about what we discussed over the last 40 minutes. The most important thing that we all should know is that hypertension is a disease which we have to be careful about. If we don't achieve the target blood pressure, which is ideally around 120/80, we, with your diet, exercise, and weight loss, then yes, we may have to consider taking a tablet in the long term. And we don't have to be worried about taking those tablets, because the new tablets are all safe, effective. There are certain groups of tablets which can cause an issue with libido in the long run, but they are all otherwise having kidney, cardiac, and vascular beneficial effects, the blood vessel beneficial effects. So there is no reason why we should not take a tablet if there is a need to take a tablet. The and the other thing is that we do have many risk factors in our daily life. The most important is the sedentary life, what we have, many of us have. You have to do regular exercise. You have to keep your body weight in the optimum range. And if you have other risk factors other than hypertension, like cholesterol and blood sugar and smoking, we have to take care of that as well. Because for us to have a healthy long life, it's very important that we control the risk factors, and the risk factors should not be above us. We should be above the risk factors, so that we don't get into major issues like a stroke or a heart attack or a heart failure later on in life.
Great.
Thank you.
Thank you so very much, Dr. Murali.
Thank you.
You've really given us a lot of information on this very important day of World Hypertension Day. As I said in the beginning, that measure your blood pressure accurately, control it, live longer. That was the motto of the session today. If you want to have any session or you want to consult Dr. Murali Krishna, you're always more than welcome. Dr. Murali is currently, as I said earlier, practicing in Prime Hospital. The number you can see at the bottom of the screen is 0429297777. You can always book an appointment, or you can always call the book an appointment through the application that we have, Prime Health Me app, that is for Android and iOS. Your recommendations are really important to us. Please do give us your reviews and your feedbacks on Prime Health page on Facebook. That will be really very important to us. If you have any queries, you can always send an email to us at myprime@primehealth.ae. Once again, Dr. Murali Krishna, thank you so much for all your time that you have given today and all the information. I'm sure people who will be watching it afterwards will have benefit out of it. So thank you very much. As we always say, the Prime is all about personalized care personally, and that's what we deliver here, and that's what Dr. Murali has tried to deliver. Thank you very much. We'll be coming back to you with another session. Take care.
Thank you. Take care. Bye.